Hello everybody, JUAN SALCEDO today, here explaining what the basic concepts of celiac disease are, who it affects, and what it's all about. Okay, so celiac disease is a very common type of disease in which the form of gluten is always trying to be absorbed by the small intestine, but after a while it doesn't work, which results in malabsorption, which is a bad absorption of nutrients, and causes the small intestine to become inflamed, which can definitely hurt a person and is very common among our population. As you can see in this picture, the normal small intestine has the microvilli and villi that extend like finger-like projections in order to help digest nutrients. But with someone that has celiac disease, you can see that the mucosa layer is flattened and that it has trouble digesting and then later on absorbing these products that come into the body. And celiac disease is all about gluten. With celiac disease, there are about 200,000 cases per year in the United States. And the main problem about this is that it can't be cured, and that if it's chronic, it can last for a long time, maybe years. But treatment may help if you look for it in the right way. Anyone in the United States or in the world particularly can have celiac disease. And once you do have it, the best way to just try and avoid it is just to have a completely gluten-free diet, as there's no complete treatment to completely cure the disease. So just avoiding things like breads and pizzas is the best way to go.
Ooh, bread. My favorite food. It's the most wonderful time of the year.
No. Gluten is found in breads, which is a mix of proteins found in wheats like barley, rye, oat, and all those types of grains. The problem here is that a person with celiac disease has an autoimmune response to gluten. When it's trying to be chemically digested in the small intestine, the lymph system attacks gluten as a mistake, which leads to malabsorption and can lead to very serious illnesses. So bread must be avoided. Okay, so here we have our capillary in the blood that's ready to receive any nutrients that is being ingested in the body. And our food stuff here is known as gluten that's trying to get through into the blood. So here we have our brush border enzymes that are used to absorb any foodstuffs to get into the blood, and they're located in the small intestine. So here we have the breakdown of our gluten, and we have our amino acids here, known as glutamic acid and proline, two basic amino acids, and they're linked by a peptide bond. So here, they're supposed to enter the brush border enzymes in order to be chemically digested, but in a person with celiac disease, there's an autoimmune response to gluten, which doesn't let it absorb and results in malabsorption. So this just can't happen. And some main symptoms of this include vomiting, which nobody wants, poor appetite usually causes with this, and then for those that like to work out, muscle wasting is involved, which is pretty unfortunate for the most part. As we can see here, about 0.75% of the population in the United States has a chance of having celiac disease. But what's even crazier about that is the fact that it can be involved in family history. As we can see here, a person with a first degree relative has a 4.5% chance of having celiac disease in the United States.